Darshan, welcome to the podcast.
Well, I'm so honored to be here. I've been a huge fan of yours since listening to your podcast actually is what fixed my gut health issues many years ago. So
Wow.
you're a trailblazer, and I just can't believe I'm on here talking to the person who fixed my own gut.
Oh my gosh. Thanks, man. I
Yeah.
appreciate it. That really means a lot to me. And I told you this before we started recording, but I have been a super fan from the sidelines of yours, not even knowing that you know me, of just what you've been doing with your centers around the country. It's so innovative. So the feeling is mutual for sure, my friend.
I really appreciate it. You don't know this, but you're weaved into the fabric of Next Health. And so,
Oh,
because gut
wow.
health is a major topic, as we know, that really affects, I would say, 80% plus of our population does not have their gut optimized.
Yeah.
And it goes in and out, as you know. And
Hmm.
we really need to put a focus on this because as a physician, I can tell you that gut health was never a focus going to medical school. And I've just recently learned about how important it is, probably one of the most important aspects of our health after listening to people like yourself, Dr. Hyman, many of our friends, making that a priority.
Yeah, absolutely. So I doing some research on your background was fascinating. I mean, you were kind of like a real life Doogie Howser MD in school. Can you go back to that? I mean, you were one of I'll let you tell the story, but I mean, you are a legend even early on.
Probably a legend in my own mind, but thank you for that. I was very lucky that for whatever reason, I was able to get through school very quickly. And it was a combination, a lot of it honestly was luck, Will. I skipped second grade because my parents didn't like the teacher and I happened to pass an exam that got me into third grade. And then we moved from New Jersey to California when I was in high school. I had enough credits, so I graduated high school a year early. And I was very lucky to go to this school, one of only a few in the country where I was able to graduate both college and medical school in 6 years. So I was 21 years old when I did my first surgery in the operating room as a surgeon. And, that's really afforded me multiple careers in medicine, which I think has been really helpful in shaping my journey and getting me to where I'm at right now.
Yeah. So I mean, you know, or I should say, how as one of the youngest medical doctors as a graduate, at 21 years old, how early on in your career did you want to start integrating wellness, functional medicine, sort of these complementary medicines within healthcare?
Well, it's really one of the typical doctor stories. I hate to say this, but I was never taught about root cause medicine, never taught about nutrition, sleep, exercise, none of the things that is really like all I talk about today. And the reason is in Western medicine, we're really just educated to diagnose disease and then find the appropriate pharmaceutical or surgery to treat that disease. And
Hmm.
that's not to say anything bad about Western medicine. Like, thank God we have Western medicine, right? Like, if you get diagnosed cancer, hit by a bus, have a heart attack, you need to go to Western Medicine Hospital and get that taken care of.
Yeah.
But I got really sick practicing in my practice because I was a busy surgeon. I was working
Hmm.
all day long. And I also ran the business. So I was literally
Hmm.
working 14, 16-hour days, seven
Hmm.
days a week. And you know what happens when you're working so hard? You just make yourself the last priority.
Yeah.
And so 8 years ago, I found myself 50 pounds overweight, massive gut health issues that led to autoimmune issues. I know that now, but also leading to cardiovascular disease, metabolic syndrome, all of that. And I found myself really, really sick, Will. And, I had a wake up call because my son was born 10 years ago. And I realized if I look at the mortality charts that I would not live long enough to see this kid graduate high school.
Hmm.
And I decided to change my life. But unfortunately, I did not have the tools in my brain on how to do that. And so I went out and I decided I need to learn on my own nutrition. I went and got a nutrition certification. I learned also how to become a trainer, how to exercise. So I got a training certification. And when I was going through this journey, I started listening to podcasts and I came upon yours and Dr. Mark Hyman and a few others. And I was like, what is this functional medicine thing? And that's what really opened my eyes, Will. And with that, I went to IFM. I'll never forget it 10 years ago. And one 3-day conference, I was able to change my health completely in 6 months. I got off autoimmune medication like methotrexate. I got off 2 blood pressure medications. I was no longer diabetic just by practicing root cause medicine.
Wow.
And that's when I decided, like, this is the kind of medicine I want to practice. I want to
Yeah.
do this for the rest of my life. So I wound down my surgical career and just, here I am.
It, wow, that's an amazing story. I mean, for people that don't know behind the scenes of functional medicine through the Institute for Functional Medicine specifically, it is, I mean, most of our colleagues are in where you came from. I mean, sort of illustrious, conventional settings and training, amazing training. But when you deal with root cause and chronic disease, and really, there's not many tools within the toolbox when you look at the people that most of the people that you're seeing on a daily basis. So you've had to go postdoctorate, like in training, kind of learn things that you didn't learn in medical school through IFM. And that's sort of first, are we there like 5 days, the AFMCP,
Yeah.
like immersive training that we all go through. I mean, it was great. Like for me, like I had a different sort of unconventional integrative medicine training. So it was like great for me, but it was like the guys I was sitting next to that had conventional training, it was like mind blowing for them because they'd never learned this stuff before, but had such a hunger for it.
Oh, I mean, it's just, you're right. I mean, I think the main kind of realization I had at that conference was I had to totally shift my mindset 180 degrees into realizing that what we're doing in medicine is just really covering up symptoms with pharmaceuticals. I was basically a glorified drug rep.
Mm.
And I wasn't making, and obviously, like, I wasn't making a real difference in people's health, and neither was the entire system. And once I had that realization through, the work of like Jeffrey Bland and reading his book and Disease Delusion, that really everything is just down to a few root causes, and we can eliminate, the 100,000 plus coded diseases that we have in our ICD-9 code manual that we use to bill insurance. Once I had that realization, I was like, I'm going to throw that manual out. I just want to do this functional root cause medicine and not even have to deal with the disease.
Yeah. And
Yeah,
most of the colleagues that we have in functional medicine that are within that model still, they graduate with IFM certification in functional medicine. They don't like it's not the individual doctor. Of course, it's the training. Of course, it's the all of that stuff. But even when they get into practice, the system itself, it's difficult to practice this because the system's not set up for that. Can you explain to that? I mean, you said unwound that conventional practice because it's really difficult to integrate this in people's lives within that system.
Yeah, because here's what happens in the current system. I just mentioned the ICD-9 code manual. And for people who don't know what that is, basically doctors only get paid when you have a diagnosis that has a numerical code for it, okay? And you have to find a numerical code to put on a billing form that you send to the insurance company, then they will write you a check for treating that diagnosis. If root causes are nowhere in that ICD-9 code manual book. So the whole system is set up to really only pay the doctor, the hospital, the pharmaceutical company if there's a diagnosed disease.
Mm-hmm.
You and I both know it takes 20 to 30 years of poor lifestyle and other factors to get to that point, right? And
Mm-hmm.
so when you have a system where the financial incentives are only in disease care, that's when we start addressing the health issues.
Mm-hmm.
And really, it all starts 20 to 30 years before. So
Yeah.
guess what? I don't even bill insurance anymore because they won't pay for anything that we're doing. And, it's just a realization and a fact that, look, we have this $1 trillion system that's been developed over the last 50 years to manage disease and help disease. And like I said earlier, thank goodness is there. But we can't expect it to take care of our health. It's not a healthcare system, it's a disease care system.
Yeah. Sadly. Well,
Yeah,
I didn't. Hopefully, you're okay with this. I want to ask you a little bit where you're talking about the convergence of health and politics, and that's the only reason why I'm bringing it up is because I'm sort
sure.
of involved in some capacity within this sort of movement.
I
What?
thank you for doing that, Will. I thank you for that. More
Thank
people
you.
need to get involved. Yes.
Thank you. Well, it's not easy. I can't imagine being an actual politician. It's not for me at all. But like, look, this matters. I mean, health of America matters. And I'm used to sort of the grassroots level just with telehealth patients, but to have sort of the people in our space, your and I space, at a seat at the table, at least for now, to have these conversations. What do you think of the Make America Great movement, the sort of diverse coalition of people within health and wellness?
Yeah, I think this movement has a name now. It's called Make America Healthy Again, right? And you have individuals like RFK and Marty Makary and Casey Means that are all proponents of health. Unfortunately, because there has been a political party that's kind of usurped this narrative, which I think has both positive and negatives, and negative being that it's very polarizing. So now, if you are not for that political party, you have to be against this movement. And I just think that's sad. I think, we
Mm-hmm.
really need to find places in this country where we can come together. And there's no better place to come together than our health of our country, because the health of our country is the health of our children. And the health of our children is, as we know, it's our future, right? Like,
Yeah.
I'm scared about the environment that our kids are going to be growing up in. I have two little ones, 10 and 7, and I hope they live as long as we do. We keep talking about longevity, but we're doing more to negatively impact our longevity than we are positively impacted. And that affects our kids. The amount of toxins we're putting into the environment, the food that we're feeding them, even making them wake up early for school, and the amount of stress and pressure we put them under with electronic devices and social media, it's just too
Mm-hmm.
much. Our biology was not meant to handle this. And if we can find this one place to come together and address these issues now, our kids will benefit. And I think there's nothing better for our country than that.
Yeah, well said. Vani Hari, who's part of that, she's been a
Yeah.
food activist for years. She said poison is not partisan, and I think that's a good way of putting it. And I've see people on the left, because this is not a partisan thing. I mean, people like Bill Maher and people like Cory Booker, all saying the same thing. I mean, we should get behind this, even if you don't like the head of that party. I mean, this coalition is actually made up of mostly Democrats or former Democrats or independents, like, because it's apolitical. It's really, we just have to work within the system to get things done.
Yeah. I mean, look, I don't know about you, but I posted something on social media about this, just expressing my happiness that we can finally address this at a national governmental level.
Yeah.
And I was attacked, and my feedback to all these people was like, look, I'm not taking sides, a political side here at all. I'm just trying to get us healthy. And if there's one issue we need to come together on, is this one.
Well said. You talk about being the CEO of your own health. Like, let's talk about what that means, and what are some biomarkers that you recommend that everybody should get ran to find out where they're at.
Yeah. So what I mean by becoming the CEO of your own health is, I think, as a nation, we've been taught, and because this, once again, this is how the system was set up, that number one, we don't own our data. Number two, our health is fully outsourced to the Western medical system, to the
Mm-hmm.
point where it's paternalistic. Like, you're not even allowed to ask for blood work. You have to fill out a form to request your medical records to even
Mm-hmm.
see what the doctor is seeing. And
Mm-hmm.
90% of the time, if you ask for something because the insurance won't pay for it, your doctor won't order it because it's not medically necessary, because you don't have the symptoms of a disease yet. And, for those of you listening, I'm, doing quotes because it's just a ridiculous system. And so finally, we've reached a moment, due to various people fighting for this, at a national level, where we can get our own blood work tested by just simply showing up to a lab and asking for it. Insurance won't pay for it, but the cash prices are dropping dramatically. And you can finally get a few biomarkers. You can get any biomarker you want, literally, but you can get a few that are incredibly important to track the directionality of your health. And, if you look at the CDC top 10 causes of death, there's really 4 or 5 things that kill most people, right? Number one being heart attacks, as we know. Number two being metabolic disease. Three is Alzheimer's eventually, and 4 is cancer, right? And
Mm-hmm.
and then if you group a bunch of them together into infections, that's another disease. So along those 5 chronic disease metrics. We have biomarkers that you can follow and understand what is the optimal range. So not when you get a disease, what is the optimal range? So you can change directionality so you don't head in that direction, right?
Mm-hmm.
And so I'll give you one example, Will. Metabolic disease we know is one of the fundamental root causes of all of these causes of death. And one of the biomarkers I have my patients follow there is hemoglobin A1C. It's a simple biomarker, a blood test that tells you your 3-month average of blood glucose for the last 3 months. And in general, in this country, 5.7 and above is prediabetes. In Europe, they don't even tell you until you're 6 and above. By then, you've pretty much deposited glucose in many of your proteins, and you have liver function issues. You're in a bad shape by the time you get to 5.7 or 6. So optimal range is as close to 5.2 or below as you can get it. And I always tell my patients, if I see you on the street walking around at a restaurant or something, I'm going to ask you, what's your hemoglobin A1C? And you should know that number off the top of your head and tell it back to me, because it's that important for people to know. Just like you know your bank account balance. You don't go anywhere without knowing how much money you have in the bank. You got to know what your hemoglobin A1C is. And that's becoming the CEO of your own health, because no company is run by the CEO by looking at their numbers once a year and having a consultant look at them and pick which numbers and tell you what's important or not, or tell you when you're bankrupt, right?
Mm-hmm.
CEOs are looking at their numbers on a daily, weekly, quarterly, monthly basis. And
Yeah.
we need to do the same with the biomarkers of our health.
Yeah. Great. Any other labs you like? I mean, A1C, any other like maybe top 5 labs that
Yeah.
you love for just everybody should get these numbers.
Here's the 5 numbers everyone needs. Number one
Okay.
is hemoglobin A1C, metabolic health. And there's other numbers that we can look into, like insulin level, fasting insulin, et cetera, if you want to
Mm-hmm.
go a little bit deeper, but at least hemoglobin A1C. We all know that most people will die of heart attacks. To be very clear, heart attacks are not due solely to cholesterol, okay?
Mm-hmm.
It's one of the factors that can lead to a heart attack if you have other risk factors. However, the best biomarker of cholesterol is ApoB. And this is something that most doctors are not even checking right now
Mm-hmm.
because they don't know about it. ApoB is basically a collection of all the forms of cholesterol in your blood that could potentially cause plaque. And so you want to keep your ApoB at an optimal level around 80 or lower if you have risk of heart disease.
Mm-hmm.
3 is HSCRP, highly sensitive C-reactive protein. That's a measure of inflammation. Inflammation is another one of those root causes of all disease. You want to be as close to 0 as possible. If you're 1 or above, we need to start looking at your gut and your oral health, because that's where most inflammation starts. Number 4, I would say, is your blood pressure. A lot of people don't realize this, but blood pressure is not diagnosed until 10 to 20 years from your first evidence of blood pressure. We know that for every 10 points that you're above 130 over 80, you have a 15% increased chance of mortality. And, this is one of those problems that people don't have a blood pressure cuff at home. And so they go to their doctor once a year. Usually it's the most stressed out person in the office, the latest person hired in the office that's checking your blood pressure. So
Mm-hmm.
90% of the time that blood pressure measurement is wrong. It's either too low or too high, and it's thrown out for years while the doctor's like, it's probably okay. Let's just check it next year. And that's a big problem. So I think
Mm-hmm.
every person, especially, if you're over the age of 25, get a blood pressure cuff, check your blood pressure once a year, treat it early, treat it aggressively, change your lifestyle. Lastly is skeletal muscle mass. So this is where, a lot of people, I say, you know what? I don't care what your weight is. So throw away your standard scale. It is garbage. Instead, buy a scale that gives you your skeletal muscle mass and your fat mass, especially if you're over 40 years old, because, you know, lack of skeletal muscle is one of the leading risk factors of all causes of disease, and
Mm-hmm.
especially death after the age of 60. And I can tell you the number of patients I see that they start declining their skeletal muscle mass significantly after the age of 40. And there's a lot of reasons for that: sedentary behavior, lack of enough protein intake, low testosterone levels, inflammation, lots of different reasons, but at least and you need to make a change if your skeletal muscle mass is going down from where you are at, in your 30s to your
Mm-hmm.
40s and 50s and beyond. So those are my
Mm-hmm.
5 top ones,
Right.
Will. I have, maybe 5 more I can add as a secondary, but if people just track those five,
Yeah.
they will know early and they will be able to change the direction of their health significantly.
Yeah. Okay. Well, I mean, since you offered, I'd love to know what the five secondary, because I'm thinking of the listeners. They're like, their ears are ringing with that. But then I want to unpack some of the things you said there. But like any, like, okay, if those were the essentials, the five
Mhm.
tests, are there like five next level things to consider?
Okay, yeah. So the next thing I would say is get an LPA done, LP little a. This is a blood test that's positive in about 15 to 20% of people. It is a particularly bad form of cholesterol protein marker
Mhm.
because it is resistant to what I would say is lifestyle interventions. I don't care
Mhm.
how good you eat, how much you exercise, how much you de-stress, you can have LP little a because it is a genetic issue that causes a particularly bad form of cholesterol that can deposit into your arterial walls. This is a blood test you only probably need to do once in your life, but if it's high, it means you have to be very aggressive about your cardiac health. Um, so that's another one on that front. I would say also, additional biomarkers of metabolic disease, so triglyceride levels and
Mhm.
insulin levels. This will change even earlier than your hemoglobin A1C. Hemoglobin A1C is kind of a lagging indicator, but it's a good 3-month average. Insulin and triglycerides you have to do when you're fasting. So that's extremely important yeah, to get an accurate measurement.
Yeah.
Next, I would say, I'm a big believer in metabolic health being a root cause of all disease. Wearing a continuous glucose monitor can be a massive game changer for people. So I love continuous glucose monitors. I think, tying that with a good book on how to manage your glucose. Casey Means just wrote a book called Good Energy. Jesse and Supe wrote a book called Glucose Revolution. I think reading a book while you're using it really helps you manage that correctly.
Mhm.
And then, did I give you five more? Was
Yeah, I
that
think
five?
no, I think you're good. Do you have any
Okay,
bonus
great.
ones? I don't want to keep throwing stuff at you, Doc,
Yeah,
but
I have another couple bonus ones. Okay.
yeah, give some bonus
All
ones.
right. Go to the website and search, go to Google and search DEXA scan in my area. And get a DEXA scan done because, excuse me, a DEXA scan will give you two critical additional pieces of information. One is your visceral fat. The amount of visceral fat you have is directly tied to the amount of inflammation that you have. And then lastly is it also gives you your bone density. So this is really important to know after the age of 40 as well, because what happens is after the age of 40, we all start losing bone. It actually is happening even sooner than that. People's
Mm.
magnesium levels are off. People don't do enough strength training. We're too sedentary and we start losing bone. And if you don't stop that process early, it's
Mhm.
really hard to play catch up when you're 60, 70, 80 years old. It's
Mhm.
almost too late. So we got to be really proactive in that as well.
Yeah, a great list. I mean, people go back and listen to this. Just take notes. Take notes. These are essentials, and they're ones that I love for baselines for any telehealth patient. So, okay,
Yeah.
so to unpack some of the things you said, I'd like to get your take on the cholesterol bit. You mentioned the ApoB, you mentioned LPA. What's your take on the conversations that are being had in our space about saturated fat and you know uh, red meat, things like this, coconut oil, butter, red meat? What's your take on it when it comes to its influence on cholesterol and if it's good or bad or indifferent?
Well, this is where you and I both know to answer that question because you and I both see patients and we both talk to so many different people, right? And
Yeah,
I can tell you it is so different from individual to individual, right? And so, when
true.
people get in a soapbox and they just start yelling something on social media about what they believe is the right kind of diet, I just think to myself, like, honestly, like that person doesn't really understand the nuances, and they're usually not someone that practices
Hmm.
medicine or practices nutrition or someone that just sees patients on a frequent basis. So, what I would say is that what I have found in my clinical practice is that most people fall somewhere on a bell-shaped curve in the middle where they have cholesterol that is a little bit high and they don't really know what to do about that. And of
Hmm.
course, in my previous life as a doctor, when I saw someone with a cholesterol a little bit high, knee-jerk reaction, there's a statin I have for you. Here you go.
Yeah.
Now I know that is probably the last thing I do is put someone on a statin. I optimize their nutrition, their movement, I think is so key. Their blood pressure is key, their inflammation and their gut health is key. Heart disease, which is why we're managing cholesterol in the first place, which is really blockages of your blood vessels going to your heart, that happens when you have four different things happening. First of that is metabolic disease in combination with inflammation, in combination with damage to the arterial wall, the endothelium, which happens with high blood pressure most commonly, but also overtraining and too much stress. And then lastly, your high ApoB is
Mm-hmm.
what finally happens at the end of this whole process to create heart disease or plaque in your blood vessels. And so, that's a long way of saying to you, Will, that it really depends.
Yeah.
I see people with ApoBs 100 plus, 120 plus, and they have zero plaque in their blood vessels. And I know that because I'm ordering the Clearly scan, which tells us exactly how much plaque they have vessel to vessel. And so to those people, I say, whatever you're doing, as long as you're not eating ultra processed food, you're good. Just keep going with it.
Yeah.
However, if I do see someone with a lot of plaque deposit in their blood vessel walls, I am fixing their gut to manage their inflammation. I am reducing their high blood pressure. I am putting them on a CGM to get their metabolic disease under control. And possibly I'm going to put them on some sort of medication to help them lower their cholesterol based on additional testing that I do to find out how much they're absorbing cholesterol versus producing cholesterol.
Great.
So the really
Great.
long answer, and I think people need to know, it's not a knee-jerk reaction.
Yeah.
And don't blame yourself if your dietary changes aren't helping that much either. There's a lot of factors at play here.
Yeah. Well, like environmental toxins, I think of too, right? It's like that can slow down those lipid markers, definitely. What's your take
Oh, we
on that?
haven't
I
even
mean,
talked about that.
yeah, so I
Yeah.
mean things like microplastics, forever chemicals, and they're kind of the research connecting them to these cardiometabolic problems.
You know what? This is something mind-blowing because I actually went to a lab and I wanted to see it for myself, microplastics in the blood vessel wall. And I mean, there they were. And also the same scientists that are finding these microplastics in the blood vessel wall using some newer technology, they're finding evidence of even particles that we breathe in through the air being deposited in the blood vessel walls as well,
Hmm.
microparticulates. And so
Hmm.
these nanoparticles are making their way into our blood vessel walls, and that's really dangerous. And what are we going to do about that? Well, we can reduce our exposure as much as possible. We could talk about reducing toxic exposure, but really we need to have a strong endothelium. Our blood vessel walls need to be strong, undamaged, and that means a lot of different things, but mainly stress management and treating high blood pressure is where I start.
Hmm. Love it. Okay,
Yeah.
so you mentioned skeletal muscle as being one of those metrics that you want to measure and see where you're at. Any tips you have to, let's just say they get that scan done and they see their skeletal muscle lower. What are some top tips to build lean muscle?
Okay, yeah, great question. So, and just to be clear, like when you get a DEXA scan done, they will tell you where your skeletal muscle mass is in relation to healthy individuals of your same age and weight, et cetera. And so that's really important. You want to have something to aim for, at least the average of healthy, and then you got to get past that as well, because we know after the age of 65, you will lose skeletal muscle mass at an advanced rate, 1 to 2% per year. So you want to get past that before you get to that age. That being said, it's never too late to start building skeletal muscle. There's multiple studies being done that show that even older individuals can build skeletal muscle at the same rate as a 20-year-old. So just by going to the gym, they'll build the same percentage of skeletal muscle as a 20-year-old. Okay, so top three ways of building skeletal muscle: increasing your protein intake to 1.5 grams per kilogram of body weight. Protein intake by itself has been shown to increase skeletal muscle mass, whether or not you're strength training. So that's number one.
Mm.
Number two, before you start strength training, just get up and move. Being sedentary is what's really killing your skeletal muscle. So if you're in an office setting every 45 minutes on the dot, get up and move around, that counteracts the negative effect of being sedentary or sitting all day. Same thing goes for if you're driving long distances in a car or at home on the couch, of course. Thirdly is you want to strength train, of course. And what I
Mhm.
really think moves the needle for people is one fact is that doing a little bit of strength training on a daily basis is 50 to 100% more effective than going to the gym twice a week and maybe missing a workout here and there. It's
Mhm.
small dosages done consistently. And if you
Mhm.
do those small dosages to failure, which means,
Mhm.
lifting so heavy that you can't do the last couple of reps in a set, that makes it even more effective. So, I
Mhm.
think we beat ourselves up sometimes with going to the gym, right? Like we try to get to the gym and then we don't go to the gym, then we feel bad. And then we just say, forget it for a week or two. And then, and then like 2, 3 weeks or a month go by before you've gone to the gym. And this is very common in February or March, right? And so I think if people can get into like a little bit of a daily habit of doing some strength training, 5 to 10 minutes even at home on a daily basis and work it into their routine with good habits, that's going to be a lot more effective.
Such good tips. What do you think? Okay, there's lots of conversations around longevity, improving health span within academia, like the research, but also in within the clinical space and people talking about it on social media. What's your take on that? What are we facing? I think. What's your take on the sort of chronological versus biological age and well, let's start there, and let's dig into some tips you have to improve it.
Yeah, absolutely. Well, so, actually, I'm really excited about it. I mean, there's so much incredible research going on right now. There's a paper written about 20 years ago, which has recently been updated, about the cellular causes of aging, right? The root causes of aging at a cellular level.
Yeah.
And we now know, the actual proteins and DNA changes that cause us to age. And, every billionaire from Mark Zuckerberg to Steve Jobs, I mean, everyone is pouring billions of dollars into developing therapeutics to address things like senescent cells and mitochondrial health and DNA methylation. And so just like ChatGPT kind of blew us away. I mean, Will, did ChatGPT blow you away when you started
Yeah,
talking to
it still does. It
it?
still
Still does.
does. I'm still in awe of it. Yes.
Yeah, it came out of nowhere.
Yeah.
Well, guess what? That same technology is being applied to biotechnology. And so we're going to be blown away, I think, with what's coming down the pipeline in the longevity space. Okay. I don't know when it's going to happen, but I see a future where we can potentially have therapeutics that can add years to our life. However, what I tell every single patient is it's not going to matter if you're a little old lady or a little old man when we get to that point in time, right? So the number one priority right now is to maximize your health span. How many years can you live in a really healthy state? So say you get to 80 and something incredible comes out, you're still healthy enough that you want to take this pill that keeps you alive 10 more years, right? But
Hmm.
if you're in a wheelchair and you can't recognize your friends or family, you're not going
Hmm.
to be taking that pill. So it's really about maximizing your health span now. And by maximizing, I mean even overshooting some of the metrics, like I talked about with skeletal muscle. Go beyond average so that when you get to 80, you are your maximal health state that you can be in.
Got it. All right. So we know food is first. We kind of touched on some of that nuance and context when it comes to nutrition earlier. But what are 5 supplements that you recommend to support someone's health span?
Yeah, great question. So, well, I'm not a big supplement pusher because I feel like people get a little bit of supplement overkill, you know what I mean?
Hmm.
And so they get a little bit of there's just too many supplements. They have so many bottles and then they
Yeah.
don't even take any of them. So I
We call
really
it we
try to
call it a supplement graveyard around here. It's like
supplement
so we have to
graveyard.
like clean out the graveyard, streamline it. Yeah.
I love that. Well, yeah, exactly. So I
Yeah.
think there's a few fundamental supplements that I really like. One is vitamin D3, K2. We test this on every patient. 90% of people are deficient in it.
Yeah.
So I like to supplement it while we're getting people out in the sun more and we continue to measure levels. And the D3, K2 form is extremely important, I think.
Hmm.
Secondly is magnesium. I've
Hmm.
seen massive health outcomes change with magnesium, everything from bone health to cardiovascular health to blood pressure being reduced, etc. I like a form that has multiple different forms of magnesium in it,
Hmm.
magnesium taurate, magnesium glycinate, etc. So I take
Hmm.
something that has multiple forms of magnesium. Thirdly is a good fish oil supplement or
Hmm.
krill oil, and there's even vegan forms now. I think that's essential to cardiac health and brain health. And then
Hmm.
fourth, I like creatine, which is really helpful for muscle health and being shown to be to help protect against cognitive decline.
Hmm.
5 to 8 grams for men and women can be helpful, but you have to
Hmm.
start slow so you don't get stomach upset and build up. And lastly, I really love supplements that focus on mitochondrial health. So
Hmm.
one of them I've been really excited about is one called True Niagen, which is a NR supplement, nicotinamide riboside. It gets absorbed into the cell and into the mitochondria quicker, according to the research, and that can really supercharge your mitochondria, which are the powerhouses of our cell.
Hmm.
Every cell in our body has mitochondria and they need power. And
Hmm.
right now, most of us are running on dim because we're using too much energy to deal with the massive amount of toxins and stress in our lives, you know? And so
Hmm.
we need to turn up the light inside of our cells, and nicotinamide riboside can help do that.
Amazing. Yeah, I've loved what True Niagen have been doing for a long time. I know they have like a lower dose. They have like a pro dose. Do you have any like pro tips? I guess for someone who's never taken nicotinamide riboside before.
Yeah, so I would say start slow. There's a 300 milligram dose. Start with that, see how you feel. Some people report that they can't sleep well with it, so I say start in the morning. Some people sleep better with it, and so
Yeah.
it's different. Once again, it's that bell-shaped curve of people.
Yeah.
And so I always say start in the morning, start slow. But then if you're getting good results, I mean, this is one of those supplements you actually feel better. You feel more energetic. You
Hmm.
feel less brain fog. You do better in the gym. Try a little bit more and see if it helps you feel better. And you can even go up to 1,000 milligrams now.
Yeah.
And what's cooler is you can get it IV too.
I was going to ask you about that. So I have taken the True Niagen NR, which is for people that we kind of touched on. It's a precursor to NAD, which you need for cellular energy, which depletes as we age. And on top of that, stress, environmental toxins further accelerates that depletion. And it's normally in capsules. That's what we're talking about right now. But yeah, tell us about that. I have not tried the IV from them yet. What's it like? What's the experience like?
So the IV is actually, I'm a little bit biased here because I just use this myself, but I will tell you that I love the IV form of NR because for the first time I can do NAD IV and not feel terrible. So regular NAD for most people gives you a lot of, I would say, chest tightness. It's not anything to do with your heart. It's just how it affects your GI system actually. And it makes you have to turn the volume down in the IV drip rate so that you can actually tolerate the IV. And it's something that takes 2 to 3 hours to do an
Yeah.
IV NAD. And this, what IV nicotinamide riboside, because it gets absorbed so quickly into the cell, it doesn't hang out in your bloodstream to cause all these negative reactions. So other than a little bit of jaw pain, I can usually do an IV nicotinamide riboside in 30 to 45 minutes and actually get more efficacy than a 3 hour NAD infusion. So for me, it's worked out great. I really like it. I've seen some people that like NAD better, but it's usually a minority of people.
Mhm.
I'm glad to have both options in our clinics, to be honest with you.
Yeah. So you're saying that because you're right. I've seen my wife has gotten NAD drips. My son actually, because he's a biohacking nerd at 17, 18 years
That's
old now.
awesome.
But it took a long time, right? Because the molecule of NAD is larger, right? Is that one of the reasons? And it just takes it. You don't feel as good, so you kind of have to slow it down. But you don't. The bioavailability and the absorption rate of NR to increase your NAD is a lot easier, so it's quicker, and you don't have the sort of the Herx responses or the negative side effects.
That's exactly right, Will. And so, the NAD molecule, it needs to undergo an enzymatic cleavage into nicotinamide riboside, the NR molecule, before it gets absorbed to the cell. So if
Hmm.
you're giving a large dose of NAD, it's going to hang out in the bloodstream until you have enough of that enzyme to break it apart and then bring it into the cell. So
Hmm.
with IVNR, you bypass that enzymatic cleavage so that you can go right into the cell. So it leaves your intravenous space and goes intracellular immediately versus waiting for an enzyme. And that's the reason it gets absorbed quicker, but also more efficiently, which
Hmm.
leads to better and quicker results and less side effects.
Got it. So what can people notice? I mean, what are some of the improvements that people notice from either taking it orally or via IV?
Well, I will read a text message I just got from from a DJ, a very famous DJ who went to a show in Vegas, came to one of our clinics, and then got the IVNR in first thing in the morning, which is usually when their DJ stint ends. And she said, I was super exhausted and had a major headache. And as soon as I left the clinic, I had so much energy. I got along my entire day, and my mental clarity was through the roof. So,
Amazing.
that's a text message I just got. And so I was like, oh, great feedback. I'll make sure I let the company know that you felt that way. So, I mean, I think this is a real world thing that people can expect. It's hard for people to do it on a regular basis, just because, we have lives and it's hard to get into the clinic to do this. But I would say a lot of our patients that can do it on a regular basis are doing it weekly. I recommend it, especially when you've had maybe you're just getting over an illness, maybe you just finished traveling, maybe you just
Hmm.
had a really rough week, a stressful week. Your nicotinamide stores are going to be really low, and you can feel it. You're dragging, you have brain fog, you are feeling tired and grouchy and low energy. All this is when I really recommend people give it a shot.
Got it. When would you recommend, like, what are the strengths or the pros, advantages to the IV NR versus the oral NR?
Yeah, I think they're different. I think IVNR is great in rescue situations, or if you don't like taking oral supplements. I think it's also great to just be on a regular daily dose. We need more energy every day. And so what I do is I take it on a regular daily dose. And whenever I have time to go to the clinic, I'll do it. I obviously make time after I've just gone back from a trip. Personally, like for me, I've noticed that I used to get sick a lot after traveling. Like it's
Hmm.
just no matter what, I would get sick for a couple of days after I got back with the sniffles or just, feeling terrible. And this has completely cut out that post-travel illness for me. And so I try to make
Hmm.
it to the clinic after every trip before I even get home, straight from the airport.
Yeah, I think you brought some great things, and this is when I definitely recommend the IV if people have access to it, right? And I told you this before, but I send people to your Next Health locations wherever they're at. But the is if they're feeling run down, like if they're feeling like something's coming on, if they're recovering from something, if they're more stressed out. I mean, traveling more. Like this is where I think IV and getting these sort of bigger doses can be really helpful. So let's talk about this. I mean, you are such an expert in the latest advancements in health technology and innovation, and like what's currently out that you're excited about as far as like the health tech space.
Okay, so there's something that I'm really excited about, which is called therapeutic plasma exchange. I'm more excited about this than potentially any other technology that we currently have available. What's great about this technology is that we've been using it in hospitals for 50 years. I mean, I remember being in medical school and bringing this machine out, but we only used it when people were really, really sick,
Hmm.
autoimmune crisis, drug toxicity, etc. And what some really smart people in Stanford and a few other places in the world figured out, and they've been doing this in Europe for the last decade, is if you use this technology early, it can really reverse inflammation, autoimmune disease, and toxic exposure, even Alzheimer's. It can slow the rate of Alzheimer's. And what therapeutic plasma exchange is, it is we hook you up to a machine with an IV, and we remove your blood actually, put it in this machine and separate it into plasma and blood cells. It's basically a giant centrifuge. So for those
Hmm.
people who have seen PRP, they know when you take a little vial of blood and you spin it into a centrifuge, it'll separate into almost half plasma, half blood cells. Now, we don't take out all your blood at the same time. It's only done like 100 cc's at a time. But what happens is the blood cells go back into you, and the plasma, which is separated, is put into a bag, which is basically discarded. So why do we do that? In your plasma lives all the toxins you've been exposed to lately, various molecules that cause inflammation, inflammatory cytokines, also proteins that can cause deleterious effects, and also in other negative molecules that can lead to further inflammation and further disease processes, even LP little a and high levels of ApoB. All of that can be removed. And
Mm.
what's incredible about this, it gives your body, your liver, your kidneys, your entire system time to catch up. It gives your
Mhm.
body basically an oil change. And what we're seeing with this is that massive amounts of inflammation reduction. We're also seeing toxic levels of
Yeah.
heavy metals and other toxins reduced dramatically. And what's great about this therapy, one last thing, Will, is that we're not giving you anything. We're removing your plasma, okay?
Hmm.
So we're not giving you a drug that can have potential side effects, right?
Hmm.
And so this treatment is very well tolerated. People just kind of sit in a chair. They don't really feel much at all. And they feel great afterwards. They're a little bit tired afterwards, maybe some people, but the next day they feel great. And a lot of the same effects as IVNR, but also a lot of other effects that we're seeing in their blood biomarkers. It's not a treatment for everybody. I mean, there are potential risks involved, and so we have to talk about those. And not everyone should have the treatment done. But for most people, I've been seeing some fantastic results.
Wonderful. So we have TPE. Certainly, I'm excited about that
Mhm.
as being more accessible for people. Any other health technologies that are out now that you're excited about?
Yeah, so I mean, I think a lot of people have heard of stem cells and exosome therapy. Because of the regulations in the United States up till now, we've kind of stifled innovation in those
Hmm.
areas. But other countries have done it right. Like Japan, what they did in Japan after one of their main scientists won the Nobel Prize in stem cell research was they said, you know what? We can see the pharmaceutical governing bodies, like equivalent to our FDA, not wanting these life-saving technologies to come out because it competes with drugs, right? So what they did was they created a separate governing body for biological therapeutics, which is what I think we need to do here in the United States, frankly.
Hmm.
But because of that, they have really accelerated innovation in Japan. And what they found is a very special class of stem cells called Muse cells, MUSC cells. And these cells can actually have an incredible effect similar to what stem cells have, but at a much accelerated rate. And what we also know about a lot of stem cells is because they're larger molecules, when you give them IV, they get stuck in the lung. And so
Hmm.
the Muse cells do is they can actually, they're tinier. And so they can get through that lung barrier and make more more of the cells get to where they're needed. Stem cells hone in on where your body needs them. They look for areas where your tissues are crying for help. Inflammation and cytokines are being poured out for where your tissues need help. And so these Muse cells can hone in on those areas and encourage the natural healing of those areas at a much more efficacy. And so,
Hmm.
we're tracking the science on this, but I think we're coming to a place where stem cell therapeutics can become more mainstream.
Yeah, I'm glad you brought that up. It's like so many people we know have to go to Asia or they go to Mexico to
Yeah.
get stem cells, right? I mean, the United States have we been thwarted, but largely you would say it's because of the positive health outcomes that could be competing with pharmaceutical drugs.
Yeah, I think that's part of it. Once again, I think we created this $1 trillion system based on, what the Rockefellers wanted back in their day. I mean, I don't know if you've heard of the Flexner report or not, but it really kind of created this system of pharmaceuticals and chemicals and
Yeah.
randomized control studies, and that's the only way to get things approved. And it is what it is, and it does its job well, but it's not a system suited for um, this new era of biologics, things like peptides and stem cells and exosomes. And so we just need to create a new system. That's what we're doing in Next Health. We're basically pressing reset and saying we need a new system, and this is what we're creating.
Yeah. Well, it should be based on outcomes, right? Not special interests and yeah. So for people that don't know, I mean, what you mentioned the Rockefellers, and I love history, like just what happened back then that kind of determined even our health policies today.
Yeah. So, when antibiotics were invented, it basically created this revolution. Like now we can create molecules that can affect our biology. Okay. And so the Rockefellers having unlimited amount of money, and this, I don't want to like throw anyone under the bus but this is all documented, it's all in history. They started basically the pharmaceutical industry, right? And so what they found was a lot of people were going to alternative therapies, once again, air quotes, to affect their health when more and more pharmaceuticals were becoming available. So they commissioned a report called the Flexner Report to look at what is the best way to teach our medical school students. Okay. And this report said anything that you give to a patient needs to have a specific amount of science behind it, something like a randomized controlled trial, to then be something that a doctor recommends. So what does that mean? Now you have to put into place the FDA to govern all of this, to
Mm-hmm.
say, okay, you want to give a patient something as a doctor, you have to make sure it's a molecule approved by this governing organization. And so what that then does is only certain companies have enough money to put it through this process, right? And so
Mm-hmm.
basically completely villainize any forms of alternative therapy around nutrition or um, sleep, exercise, even hormones, et cetera, because these are not molecules that can be created by a pharmaceutical company. And it basically also made doctors glorified drug representatives, I hate to say
Yeah.
it, but,
Yeah.
sadly, we were basically taught like these are the molecules that you can use to affect these diseases. And so, if you can kind of track the science, you can read about it all online, but what's happened over the course of history is that was kind of the inciting event that created this $1 trillion industry that we have now.
Mm-hmm. Thank you for that.
Yeah.
As you know, the podcast, it's called The Art of Being Well. At the end of every episode, we have your art of being well. I'm really excited to pick your brain about these things. What's the worst tasting healthy food that you eat? It tastes freaking disgusting, but you have it because of some health benefit, some health science behind it.
Oh, wow. That's a good one. I would say, let me think here. Um, Celery. I'm just not a big fan of celery. I think it doesn't have
Me
any
either.
taste.
Yeah. Celery
Yeah,
juice, like none of that stuff. You're not doing
yeah,
it for the taste.
exactly. You're not doing it for the taste. You're doing it for the fiber. And
Yeah.
I think that's the one that's the hardest for me to swallow it. Whenever I get a crudité at the restaurant, the celery is the last thing in there.
Yeah. Save it for the last. That's funny. Do you have any, well, you mentioned not being a massive supplement guy. Like if you mentioned the five that you have there for longevity, do you have any, if you had to pick like two essentials, just from a overall energy standpoint, if someone's dealing with low energy, what would you recommend?
Yeah, I think on the low energy front, once again, nicotinamide riboside, and then there's another compound called urolithin A, which is a really interesting compound
Yeah.
that you get through a company called Timeline Nutrition. I love that one because it also can improve your mitochondrial energy production by actually helping you make more mitochondria, which is amazing. So that's a
Yeah.
great one too.
Yeah, and I've had Dr. Anurag Singh on the
Oh yeah.
podcast. Just brilliant. Yeah, he's the medical director for that Timeline
Will, you know
Nutrition.
what's really great about that too? It's like what you talk about. Like, our gut is basically a $1 billion pharmaceutical company that lives inside of us. And if we keep it healthy, it can make compounds like urolithin A, which improve our energy production for us. I mean, this
Yeah,
is one example of the million things that it does for us. Produces GLPs, helps us absorb nutrients.
yeah,
Keeping our gut healthy, it's massively important.
so true. It's amazing. And it like it never the sacredness of it, like the beauty of it all, the intricacy is just. You'd think we would get over it, but it's hard to whenever you see the profundity of the human body, right?
Yeah. Yeah, exactly.
The do you have you read any books lately, or maybe not even just lately? I mean, just in general. I want to get like a running art of being well book club list. It could be fiction or nonfiction, but just what's a book that people should be reading?
Ooh, that's a great question. Okay, so one of the ones I mentioned earlier is by Casey Means. It's called Good Energy. That is one of my favorite books right now because it's really gets down to the core of the issue of metabolic health, which we need to bring to the forefront. Okay, so
Hmm.
that's one. The other one is let me think here. Uh, I'm looking it up in my Amazon book list right
That's
now.
fine. That's fine.
Or
That's
it's something about the art of nature or something like that.
okay.
Really, really great book. And it talks about how intricately beautiful nature, the secret wisdom of nature. I just found it.
Okay.
What it's a great book. It talks about how nature works together in beautiful systems to keep our earth healthy. And we should stop messing with it. And it just double clicks on why we need to be so respectful about what our environment and what's
Hmm.
around us. And then I've been reading Marty McCary's book on about health as well, and what went wrong in our health system. And that book is so impactful for me because he's a doctor, and I lived through all the misinformation over the last 30 years that we've been um, telling our patients. Basically, the book is called Blind Spots, and it talks about this whole like low fat diet recommendation. It talks about antibiotics and overprescribing them. There's so many things that just hits home why hormone therapy was villainized for a long time. And I think everyone needs to read it so they understand what is the reality of all the misinformation that we've been taught. Because there's some big items that we've been taught that even doctors can't get past, like the low fat diet or hormone replacement therapy causing cancer. And this book really breaks it down into why we need to get over that and
Hmm.
understand that we were wrong and here's the correct information.
Yeah, I love that.
Yeah.
What is somewhere that you've been to, like vacation, holiday, that should be on other people's bucket list?
Okay. So Alaska, for sure. Everyone should go to Alaska. And when you land in Anchorage and then you take a little plane out to the middle of nowhere somewhere, there's a lot of different lodges out there, like fishing lodges and just adventure lodges. That's a game changer because number one, you are really in unspoiled nature. And to see that with your own eyes, what that really looks like,
Hmm.
it's just mind blowing. And it's a great way to disconnect and become one with nature again. I love
So
Alaska.
so good. I've never been, but it is on my list for sure. Uh,
Uh,
what is? Do you have any like places that you have never been that's on your bucket list?
yeah. Antarctica and Australia. Those are my
Okay,
two bucket list places.
amazing. Anywhere specifically in Australia?
I keep hearing that if you go to the Gold, I'm sorry, I keep hearing if you go to the Gold Coast, you'll never come back. So maybe that's why I've saved it for last. But yeah, Bondi Beach, and I just hear from my friends that live there. And I've literally had this conversation 5 times in the last couple of weeks. It's so crazy you're asking me this question. But yeah, Australia, definitely Gold Coast for sure.
Do you know? Most people don't know, so don't feel worried if you don't know. But do you know what Enneagram you are? It's like a personality type. There's nine
Ah,
types. You
I
don't know,
you're
Dr. Shah.
this is so weird, Will, because you're the second person in 2 days that has asked me this. And I've
Really?
had the test done. Yes, I've had the test done, and I don't remember, but I will look up the
I'll
results. Now I
text you afterwards and we'll get it. I'll put it in the show notes for people that want to know.
yeah. Thank you.
Hey, that's funny. That's okay. Literally, like 1 out of 10 people know, and I don't know why I keep asking guests this because I'm curious and I want to know because I like through the conversation I'm like thinking, okay, I wonder which one they are. That's why I ask it. But, anyways,
It's a
we're
great question though, because you can kind of cut to the chase of getting to really
yeah.
know them by knowing their Enneagram.
I ask telehealth patients that too, and they don't know why a functional medicine doctor's asking them that. But it helps me like everyone sees the world differently, and like
Yeah.
receives information differently, and does do relationships differently, right?
Yeah.
So where can people go? Tell people where they can go to learn more about your work with Next Health and all the things we talked about.
Sure. Thank you for asking that, Will. So, if you would like to participate in a new form of healthcare wrapped around functional medicine and have a place to go to get IVNR, plasma exchange, those kind of things. We have clinics in LA and New York, and we're soon opening in Miami, Nashville. Can't wait for your son to come visit. He will love it. It's a biohacker's paradise. We also have things like sauna and cold and infrared and hyperbaric oxygen. We have all of it under one roof. And so that's Next Health, and it's next www.next, sorry, www.next.health, or www.next-health.com. And then for me personally, I have a podcast called Extend. I can't wait to have you on, Will.
Can't
And
wait.
then also I have my social media, which is at Darshan Shah MD for all the channels.
Thanks for coming on, my friend.
Thank you, Will. That was fantastic. Really appreciate you having me on.